In addition to cows receiving scheduled maintenance trims, lame cows should be identified and sent to the trim chute for lesion identification and treatment. Steps 1 through 3 of the Dutch trimming method are completed first, followed by Step 4, therapeutic trimming. Using tools such as a hoof knife and hoof tester, the trimmer can investigate the claw for potential lesions. Some lesions are obvious, while others require a more thorough investigation. In the case of a sole ulcer or white line abscess, therapeutic trimming to remove necrotic tissue followed by application of a block may be required. A block is applied to the healthy claw to increase height and relieve pressure on the affected claw to promote healing. A wheel grinder can be used to lightly rough up the claw surface to improve adhesion of the glue. Glue is applied to the surface of the block and then pressed into place on the sole of the healthy claw. Once the block has been properly applied, the grinder can be used to modify the block if necessary to improve functionality. Treating all lesions begins with a functional trim to restore claw length and balance, followed by therapeutic trimming. When a sole ulcer is identified, remove all necrotic tissue and slope the area around the lesion. Be careful not to create a hole where dirt and manure can lodge. When removing necrotic tissue around the lesion, take care not to cut into the corium beneath the horn. After all loose horn and necrotic tissue has been removed, apply a block to the healthy claw to relieve pressure and promote healing. The white line is the tissue connecting the hard outer wall of the claw to the sole. Lesions occurring in the white line begin on the bottom of the claw. In severe cases, these lesions can travel up the inside wall of the claw and rupture on the hairline at the top of the claw. These lesions can be extremely painful and create severe lameness. As with sole ulcers, treatment requires removal of all diseased tissue and loose horn, followed by proper application of a block on the healthy claw. Normally, blocks are applied to a healthy claw to relieve pressure and promote healing in the diseased claw. In the case of thin soles, a special thin sole block is actually applied to the affected claw using the same techniques explained earlier in this video. Applying a thin sole block directly on a thin sole provides protection to the walking surface and eliminates wear. This allows the sole to return to a normal thickness. When an infectious claw lesion, such as acute digital dermatitis, is present, treatment will often require consultation with the attending veterinarian. The lesion should be thoroughly cleaned to maximize contact with the treatment prescribed. Next, use a minimal amount of vet wrap to hold the treatment in contact with the lesion. The wrap should remain in place for approximately 24 hours. Remove any wraps that remain on after 48 hours. For more information on Zinpro Performance Minerals and hoof trimming, contact your Zinpro representative or visit zinpro.com.